so much for the introduction. And for those of you that have the opportunity, go ahead and bring your cameras up. I don't think it's going to probably cause any kind of an issue, but it makes it much easier to talk to an audience than if everybody's blank. Again, my name is Carola, and I am with South Dakota EMS for Children, and I'm here to talk to you about children with special healthcare needs. We're going to start here real quick. This little gal is just absolutely adorable. My focus is actually going to be on EMS and EMS agencies, and then we're going to look at non-transport. So we're going to look at those fire rescue services out there that are not transporting as well. I want to read you something here that I kind of wrote, it's been a couple weeks ago. Geographically isolated communities rely on their non-transport fire rescue volunteers to treat and stabilize patients for extended times while waiting for BLS, ALS, or air medical transport services. Addressing the challenges and understanding that volunteer healthcare providers are restricted and unable to provide the standards of care for pediatric patients on scene due to equipment that is non-existent or outdated is a priority. To bring select rural frontier services up to the national equipment guideline levels, and additional purchases are needed for that for pediatric equipment. How many of you fall into that group? Everybody EMS and everyone with an ambulance service that's on?
There's probably a handful of folks that aren't necessarily associated with ambulance services
Right.
On our call.
Right.
I'm a legislator on the call, just paying attention.
Hey, Carl, how are you? I have had the opportunity we've had conversations before. It's been a while.
Yep, good to hear from you.
So fantastic. Welcome to our visit tonight. So I'm going to try to move this forward. Let me see what I got to do here. Oop. What are you seeing right now? Are you seeing my name and the whole gamut? You see our name and our logo?
We've got EMS, children with special healthcare needs, non-transport fire rescue with that little gal.
It's not moving across here. Let me figure this out. Okay, how about now?
Now we got your name and your logo. Yep.
Now you got my name and my logo. Fantastic. So with that, this is our new logo. And here's something I want you folks to kind of consider. We're super, super passionate about this logo. And I may be requesting some of you folks, put out a request for you folks to maybe consider writing our federal HRSA group due to the fact of how significant and how important it is to have the star quilt. It represents our Native American communities and our culture that we embrace in the state of South Dakota. And we're super, super proud of it. And they're looking at going to a different logo that is very, very, very simple. And anyway, so I may look for some passion from you guys and some letters of recommendation with that. So with that, I want to bring you up to date. EMS for Children, we've been around since 1993. We do have a grant through HRSA, and then we pursue a number of other grants as well. I work very, very closely with the Department of Health, and that would be the healthcare coalitions. We have a fantastic relationship with them. With the Department of Health, hospital preparedness as well. Most of you folks who have any kind of pediatric equipment, that's kind of where our efforts have come from, is the collaborative efforts and like-mindedness. That's where your pediatric equipment has come from. Those of you that are new most likely probably have no clue where that's come from over the years. Then we also work with the Office of Highway Safety as well. Our whole mission is basically to ensure that all children receive appropriate and optimal care in the event of an emergency. So that's any kid that's sick or has a traumatic severe injury. We want to make sure that you have the resources, the equipment, and the training to do the best that you can to stabilize that kid and move them forward to the appropriate hospital facility or whatever means that we need to get them moving on. And that all requires a lot of resources, and it requires training. When we look at pediatrics, and I'll kind of back up with pediatrics just a little bit. Pediatrics are halo events. So when I talk about halo events, does anybody know what that means or what I mean by a halo event? When you think of halos, you think of little angels, right? Okay, so what if I said high acuity, low occurrence? So typically, so we're rural and very, very Midwestern, and in our Midwestern roots, I'm just as Midwestern as all you folks are. I can throw in all y'all down. But as rule is what we are, we don't call for help unless we truly honestly need help. And then we get that pediatric call that we're not trained up for. Those are the calls that are stressors. Those are the calls that basically kind of push us over the edge when we hear that call come out there. We need to be prepared more so for pediatric calls than we do for the adult. We can work an adult all day long. We do a great job with geriatrics all day, but with the pediatrics, those are the ones that you really need to focus on. And now let's throw out one more and let's put a little bit of a twist in there. How many of you have children with special health care needs in your community? Carrie, how many children with special health care needs do you have in your community that you can think of off the top of your head?
I think there's 3 of them.
3? Okay. Edna, how many kids you got in your community that are children with special health care needs?
Can you hear me?
Yeah.
I would say there's probably at least half a dozen. We have a couple with retinoblastoma, if anybody's familiar with that.
Okay. Tell us about it.
One of them has a false eye.
Okay.
He's in elementary school. Another, she is in high school now, but she is considered legally blind.
Okay.
So that poses issues out here in our rural environment.
Okay. Constance, how many kids in your community do you have that are children with special health care needs? Somebody else pipe up. Valerie, Janet, Christina.
This is Nancy. I'm in Webster, and we have some severely autistic children, but sadly, a little 11-year-old girl just died from juvenile Huntington's disease. So that was quite difficult for the students at school.
Was the Huntington's associated with COVID by any chance?
No, it's a genetic. She had a juvenile
Okay.
degenerative disease.
Okay. Okay. Just double checking here. Okay. So then I'm going to move on. So we're going to talk about a little bit about children with special health care needs. It's not so much about getting into the deep, dark waters of it. What I want you to realize that in your communities that you have children with special health care needs. And with that, we need to be thinking about how are we going to take care? How are we going to communicate with these kids? How are we going to care for these kids? And what are the resources that we have? And we're going to move forward from there. Other things we can talk about, the atypical development. We can provide accommodations for developmental characteristics that they have, increase their provider comfort level with caring for children with special health care needs as well. Then we'll move on to more objectives there. Whoop, whoop. You're going to describe how many families. So guess how many families in the state or in nationally, how many families? So one in how many families has a child with special health care needs, do you think?
I'd say 1 in 3.
1 in 5. Very, very close. 1 in 5. So I'll show you some numbers here in just a little bit as we kind of move down. So we know that our state, our wonderful state of South Dakota, we have 66 counties, 33 are frontier, 31 are rural. And then we throw in Rapid City, and then we throw in Sioux Falls. What we look at is that our state basically has made the statement that a majority of our counties are underserved. So we have an underserved population. We have, again, so when I read that to you, the geographical challenges that we have, access to emergency care is significantly delayed due to our geographical challenges. How many of you have had that 90-minute transport to Rapid City, that 45-minute transport? Edna, what's your closest hospital you go to? Do you go to Phillip or where do you go?
Depending on the call, either Phillip or Pierre.
Phillip or Pierre? How about Nancy? Where do you guys go?
Sorry, I missed the question.
No, you guys better pay attention. I'm just picking on you, Nancy. No, the question is what's your distance for transport? So how long do you have to go? What's your nearest hospital for transport?
Well, we have our local Webster Hospital, but then Aberdeen or Watertown for
Aberdeen or Watertown would be your bigger hospital
sometimes
that you would transport
transfer to
to.
Sioux Falls or Fargo.
Okay, very, very good. So those are things to kind of keep in mind. In the state of South Dakota, and it's kind of been a number that stays kind of straight across the board, we run between 7,000 and 8,000 calls a year. It doesn't really vacillate a whole lot. We did not see an increase in numbers, maybe about 200 with COVID as COVID came on board. However, I am very suspicious that we had more calls than that. What would make me more suspicious that we would had more calls than the 7,500? We probably went up about 200 calls with pediatric calls in the state of South Dakota. What would you think might be some variables that would change the call ratio? I think it's more than, I think we ran more than 7,500 calls. What did Rapid City do out there? How about their community paramedicine program? How many kids do you think that we did not see or did not get transported? How about the reservations and what they were doing in order to, even with the number of transports that they had, the reservations as far as COVID patients, a lot of them were transporting folks to different hospital facilities in state, out of state, and they were transporting them via van. And a number of those folks were several folks in a van. Were they being documented? Were they not being documented? So that's one of the things that we need to kind of keep in mind. Again, make sure that you realize that your pediatrics are under the age of 18. So we look at birth to 18 years of age is what we're looking for pediatrics. When we talk about pediatrics in the state of South Dakota, typically we look at 25% of the kids in our communities are children. However, when you do the numbers here, the most recent is that we're 23%. 17% of our kids live below the federal poverty level. And again, South Dakota ranks 5th in the nation for the death rate for children's ages 1 through 14. I talked to Dr. Snell the other day. We talked about child abuse and the child abuse cases. And if the child abuse cases had went up, homicide for children did not go up to his knowledge that he has seen. However, the child abuse cases are still out there. It makes me wonder if we saw the reporting that maybe we would have seen otherwise. And then a majority of our kids are treated in frontier rural emergency departments as well. So we're talking those small rural community hospitals is where they're treated. So what are special health care needs? So first of all, we need to refer to children with special health care needs. They're people first. We're not focusing on their disability. We're focusing on their abilities. And they're at an increased risk. An increased risk for, they're at an increased risk for chronic physical, developmental, behavioral, or emotional conditions that require health-related services that is usually beyond that required by most children. So those are things to kind of keep in mind with those children with special health care needs. Again, 1 in 5 families have a child who has special health care needs. Who's the expert when it comes to taking care of a child with special health care needs?
Mom.
Mom, dad, the family members are. So one of the things that I will caution you folks is the way that we've been trained, and in our training, we kind of come in. Most of us probably have type A or AA personalities. We come in, we take care of business. And when we come in and we take care of business, and now we throw a child in there, and now we throw a child with special health care needs in there, our stress levels are way up there. We may not hear. We may be blinded or focused or have that tunnel vision, and we might not be hearing what mom's over here saying as far as something so simple as suctioning a trach or something like that. You may not be able to suction a trach at a BLS level, but mom certainly can. But maybe she's flustered, and now you have to step back and you have to do the communication with her in order to talk her and walk her through that so that you can have that child appropriately suctioned. And then you can either bag over that, or you can put a non-rebreather over the top of that trach, or the stoma, or whatever the case may be. So those are things that we really, really honestly need to keep in mind when we're looking at who's the expert here. I am most definitely not the expert. I can run a vent, I can run a line, I can put lines in, and I can do trachs and all of those things. I can do a lot of those things, but when it comes to a child who has special health care needs, that we have such a vast array of diagnoses, if you will, I don't understand 95% of them. and it's not something that I'm completely familiar with. So I need to ask the experts. And sometimes you don't get all of the information, or you can't process all of the information because you're trying to take care of the ABCs. And that's really critical in what we actually do. All right, so we're going to move down again. So again, we look at our population. I talked to you guys a little bit about that. National data says that about 20% of our children under the age of 18 have a special health care need. When I look at where I collect the data, or where I've collected the data over the last several years, it's coming from the Department of Education. So it comes from the Department of Education, and then we look at birth to 3. That's where we're getting the information. Some of the information is being lost, so it gets lost in translation, and it gets lost when the BIAs, or the Bureau of Indian Affairs, a lot of those folks do not include that data as well, or it's not included as well. When we look at our numbers in the state of South Dakota, I can show you for sure 10%. I can most definitely guarantee you that we probably have 19 to 22% if we would really be able to pull those numbers together. Really, we really need to do a really good survey on it, is what we need to do. Here's some of an idea, the latest information in 2018, autism spectrum disorder, or ASD, that's typically where we see most of our disabilities. Cognitive disabilities rolls right up there. And then, and so that's got a comparison. So you have 2018 and then a 2017 comparison. Deafness, emotional disturbances. So when we look at behavioral health, mental health, those cases with pediatrics, those are real, and those are things that we need to figure out how we're going to take care of those children as well. Specific learning disabilities, vision losses, a lot of those other things. So you guys can kind of read and get an idea, but we have about 21,000 kids across the state of South Dakota, or 22,000 across the state of South Dakota that have a disability for that we're getting the numbers on. So those numbers are a little bit skewed. When we look at our percentages, we look at Native American, Hispanic, multiracial, Pacific Islander, and then our Caucasian population as well. So it has a decent idea of where our numbers are. So we talk about, again, I kind of went and I probably maybe got ahead of myself a little bit. When we talk about pediophobia is the fear of kids. In all honesty, folks, every EMS course that I have ever been through, or every EMS course when we first started the EMS course, one, we skim over the top of pediatrics. I think it's a fear. There's a fear of pediatrics. We've been taught early on to fear pediatrics rather than embrace the tools that we have to treat pediatrics. That's why when I tell you that's those halo events and we need to keep them at the forefront, those are the ones that we need to practice, and those are the ones that we need to be very proficient at, because they're high stressors. And then you need to drop your attitudes. So when you drop your attitude and you embrace this and you listen to the parents and you work with everything, I think that's where it's going to make it much easier for you folks to treat a patient, a pediatric patient. And then we look at our communities. When we're looking at communities, and again, I don't know how much you guys really honestly know about me. I think everybody thinks that I'm from Sioux Falls and that I flew and then I came from a big metropolitan area. I'll back up a few steps. I'm a farm girl. I still have farmland in Nebraska. We raised cattle, hogs, kids, ducks, chickens, and the whole 9 yards. Our nearest hospital was 60 miles away. So I get where you're coming from. And now that's where my rural and frontier passion comes from for my EMS agencies, for my non-transport agencies. That's where all of that comes from. All day long, we've got it where it's, the resources are available within Sioux Falls and our larger cities. So when we look at children with special health care needs, you look at that little sweet little pumpkin over there. Sorry, excuse me. My dogs are actually there. They went to work with Mom Day this evening. So when we look at this little pumpkin here, would this intimidate you if you came up on scene? I most certainly would be intimidated. What kind of things do you see? She's got a ventilator there. She's got a ventilator. Looks like she's probably got a G-tube. She's got a bunch of other little devices as well. That would be challenging to me when I walk in. It would be very, very challenging. that's where you need to have that, take that opportunity to listen to mom and figure out what's basically mom, dad, or whoever the caregiver is, and pay attention to what's actually going on with that child. So we can look at this one here. This one even more so complicated. Now we've got oxygen in the room. We've got a blender in the room. We've got a vent in the room. We have IV tubing in the room. Oh, what else do we have? The child is propped up. The way this child is basically, when we look at the physical, just the physical look of the child there, what's concerning to you?
There's lots of things going on there.
One,
Lots.
no neck, no neck, big chubby baby, big head. I'm looking at, I see an IV. We would not want to lose that IV. Definitely. So if you look at that tubing that's basically going from the vent, that tubing, basically the blue tubing is basically feeding into the tracheostomy. And then there's that little plastic white tube that's there. That's suction, folks. So you can actually do in suction right through that tracheostomy right there, or through the stoma, whatever that happens to be. I can't see it close enough, but you can actually use that to suction. Is that something as a BLS person that you're going to probably do? Most likely not. I'd probably have mom go ahead and incorporate that suction, or one of the caregivers. But as a medic, you folks can actually do that as well. All right. Oop. A little too fast. Taz, you need to come over here. So we talk about medical equipment, and what kind of medical equipment do we actually have? So we have wheelchairs and walkers and crutches, BiPAPs. Can you bring it with you? That becomes a question as well. Do you have the room to bring it with you? This little guy here, you know, most likely he's cardiac. He's on a, he's got his cardiac set up for him. I'm sure that little blue, I don't know who that is. Anyway, his little blue puppet better go with him as well. So can you replicate the vent settings? If you have a nurse, so we had believe it or not, one of my pediatric patients had Pompe's disease. They followed him very, very closely. I had a number of folks, so you guys know that I worked out at North Carolina, close to Duke. And although my patient was 30 some years old, he was still being followed by a pediatric clinic and a pediatric hospital. And with that, they had taken such good care of him. His lifespan was between 5 to 6 years of age. And with the cares that he received, and he made it to 30, 35, somewhere in there is what he made it to. I knew absolutely nothing about Pompe's. I'd probably have to look it up a little bit, but I can tell you this, when his nurse was there, and his nurse most often was on the scene, we would load all of his equipment up, and it would take us a half an hour to 45 minutes to load his equipment up, take the nurse. He did all the vent settings. He made sure we had him positioned appropriately, and then we would take him to the hospital, and then on the trip back, we would do the same thing. So those are things to kind of think about. Make sure that you're taking your nurse with you if you have someone who has some special healthcare needs. That can you get the equipment on there? The complaint may be related to a special medical need, or it may not. So those are things to kind of keep in mind. What do we look at? Is this an equipment problem? Do we have mechanical failures? Do we have illness? Do we have infection? Has a child been injured? And we haven't seen, you know, we're not seeing the injury. We had a case not that long ago where we had a child, and the focus became about the child's diagnosis, but his little brother basically jumped on him and ended up with the focus being more so on the child's, I want to call it the child's prognosis or the diagnosis. And in fact, what had happened when he jumped on him, he broke his rib and he ended up with a pneumo. So don't get too focused on that. And then we always look at these children here. Don't get tunnel visions. 4 times more than likely, those kids are victims of a crime. They can either be physical or sexual abuse. These kids oftentimes are, they're groomed, and that grooming process, and they don't know better. They can tell you something. There's some horror stories. I don't know if some of you folks had the opportunity to sit in on our sex trafficking. That was probably our biggest training that we did. And it's amazing to listen to the grooming techniques and things that are out there. But keep in mind with our kids with special healthcare needs that it probably happens even more so. With that, we go to medical devices, and then those medical devices can be central lines. The central spinal fluid shunt, dialysis, colonoscomies, ileostomies, vagal nerve stimulators, pumps, pacemakers, feeding tubes, all kinds of things that would be very, very intimidating to those of us who do not work in the pediatric world on a regular basis. Most of these I've been exposed to, but if you've not had that exposure, it is kind of intimidating. That's where, when I ask you how many children that you have in your community, this is the time where hopefully we'll start building a program, and we're working on it on the back end over here. And by over here, I mean South Dakota EMS for Children is building a program so that within your community that you actually start working with your families. That's where we're working with the Pediatric Emergency Care Champion, or the PECs. Your pediatric champions hopefully can move a project like this forward and get to know who your children are with special healthcare needs. You want to assess your patient, not access your patient, but you want to assess your patient when you're assessing what's their baseline vitals. So when you're looking at a baseline and you have a kid that's normal O2 sats of 86%, are you going to put them on a non-rebreather? Are you going to bag them up to 94%? You're not. You need to know what their normal baseline is for them. Don't assume that they have a cognitive impairment. These kids, they're listening. A lot of times they have their little boxes, their iPads or whatever. They can actually communicate with you. Give them the opportunity to communicate with you as well. They may exhibit their pain. They might bite. They might kick. They might hit. We want an emergency information form. Keep in mind where your distance, how far you have to go as far as your distance for where you're going to be traveling to, what's your best approach. And then we look at your implants that are delivering any medications. Are they malfunctioning or do they have them? Where's our transport? And then what do we need to bring along? And parents are still, again, the parents are your experts with all of that as well. So again, don't be fooled by those unusual vitals. They may be different than what you are normal, what's normal for you and what you've been trained to see. You have to come up with the best response. How about a child who has maybe a rod in their spine, and how do you take care of that child as far as making sure that you do the correct padding so that they're comfortably being transported? Many times the kids are have very atypical signs and symptoms. This little guy, if that's not his sister, I'm sure it's his mom. He is just absolutely adorable, and you can just see how close of a relationship that they have. Separating those two would be very devastating, but how do you transport him in the back of your truck, and how do you transport him safely? And that's something we'll talk about a little bit more too. We can talk about the congenital heart diseases. And again, I'm not going to go into them so much. I'm just going to bring you some awareness of what you have within your communities, and that you know that what your O2 sats are, what their normal color is, what their cap refill is. Do they need a normal saline? So with congenital heart diseases, if you're a medic or you are an AEMT, you're not going to just basically do a fluid bolus at 20 cc per kilogram or 20 milliliters per kilogram. You're going to dump that down a little bit, and you're going to bring it over 5 to 10 milliliters only if it's needed. You're going to listen to breath sounds, and then when you listen to breath sounds, you're going to do it slow. It's going to be a slow bolus. So that slow bolus is going to be about 20 minutes over 20 minutes. where we look at a kid who might be hypovolemic and a child who doesn't have some of these issues, that's hypovolemic, maybe diarrhea, nausea, vomiting, could be from COVID or something on that order, and they need a fluid bolus. Typically what that fluid bolus is it's 20 cc per kilogram over 5 to 10 minutes. You need to fill their tank up quickly. Congenital heart disease, you're going to put them into respiratory failure. So what you'll put them into is congestive heart failure, and you cannot get that fluid off fast enough for these little ones. Respiratory complexities, they got a small mouth, they have a large tongue. A lot of times their airway tissue is super soft and it's very flaccid. You might have difficulty managing their secretions. You may have to have suction available at all times, so that'd be your Yankauer, and maybe your Yankauer is kind of like going to the dentist and it just sits in the corner of the mouth. Foreign body obstruction, even with your older kids. And then we look at our cognitive impairments. When we look at cognitive impairments as well, things to keep in mind, it may be difficult to get a good history without the caregiver there. And then you need adequate time to assess and prepare to transfer that child as well. Oh, she's just a little doll baby. Cerebral palsy, with cerebral palsy, it's atypical muscle tone and posture. They have muscle spasms, they have tremors. A lot of times they have hearing and vision problems, and then they have seizures up to 50% of the time. So that's something to kind of keep in mind. Seizures are scary. They're scary on a normal basis. And then we look at with our children with cerebral palsy or with CP, we need to pay attention to that as well. We do need to transport their wheelchairs or their walkers with the child. They rely on them, and that's part of their independence. And these children, as they grow, they've endured and they've persevered, and they have these great little personalities, and they're strong-willed and they're strong-minded. And that's what gets them through where they are. So when they get older into their teen years, they may be just as, when we look at our teenage years, and they may push back just as much or even more so, because they've been in situations that have really challenged them. Down syndrome, when we look at Down syndrome kids, oh my gosh, he's adorable as well. Decreased muscle tone, intellectual development, hyperflexibility. The C-spine may be unstable, C-spine instability, thyroid issues, visual, large tongue. These kids typically, they'll wander. They can wander around. They get obsessive and compulsive. There's a number of Down children that I am aware of that one little guy, he wears a suit and tie every day, suit and tie. And that's just part of who he is. They can be very stubborn, oppositional, and they may have impulsive behaviors. Autism spectrum disorders, the ASD, they may run from you. They may avoid contact. They may not understand what you're saying. One of the things that you need to do is you need to slow down, avoid your lights, avoid the sounds and the crowds. They may scream, they may self-injure. They may not feel or acknowledge pain, and they often do not understand if they've been sexually assaulted or the molestation that could be happening in their worlds as well. Search and rescue, when you're looking for search and rescue for a lot of these kids, they tend to gravitate towards water. So if you have a water source, a pool, a stream, a river, even the bathroom with a bathtub, pay attention to where they are. They love cars. So when you're looking at cars and they're places where they like to seek some shelter, the trunk might be a place. They may lock themselves in a car. That's where you're going to look for these kids as well. So when you're search and rescue out there, kind of send somebody towards whatever resource that you have for water, and then cars and trains, et cetera, et cetera. Consult the caregiver. Make sure you're speaking to the patient. Speak directly to them. Excuse me. Avoid contact. Be very slow and stay to their distal area and give them time. Assume that they understand regardless if they're able to speak to you or not. And then they have communication devices. Make yourself familiar with their communication devices and use their communication devices. Sometimes they don't care for adhesives. And then the other thing is pica. So that's with the hair things and stuff on that order as well. Oh, let's get you going here. Sensory impairments. Mental health and behavioral disorders, anxiety, panic disorders, depression, post-traumatic stress disorder, obsessive compulsive, attention deficit, hyperactive. So you got ADD, ADHD, eating disorders with your kids that do have eating disorders, oppositional defiant disorder, conduct disorder. And we see a number of kids in our school systems that have a number of behavioral health issues. Behavioral health is really being brought to the forefront across the state of South Dakota. There's just not enough places to take these kids. A lot of times you'll take them into the ED, you know that they need probably to go for treatment, and finding that area where they can actually be treated or get treatment for 15, 20, 30 days is really, really tough. Avera's done a really good job of increasing their behavioral health units and their capacity. And we're really pushing out a lot of programs out there of how do we manage and deal with children who have special or mental health and behavioral disorders as well. Sensory impairments, Edna basically had brought this up when we look at blindness. So you need to advise before you're touching them. Let the patients touch their your equipment that you have. Give them an idea of what, be descriptive, I guess is the best way. Hearing loss, make sure you're facing the patient. If bring sign language, if there's an interpreter along. A lot of kids can make sure you're keeping track of their hearing aids. It's no different than an adult's false teeth or a geriatric patient's false teeth. Their hearing aids are very important to them. Their cochlear ear implants, pay attention to all that. So when we look at the American Disabilities Act, you have a requirement to transport service dogs and or mini horses. Those are the only two. You don't have to transport the family pig. You don't have to transport the gerbil or the guinea pig or whatever the case may be. Those are the only two. And that horse, I believe, has to be under 24 to 34 inches at the shoulder in order for those to be transported. So something to keep in mind when you're transporting, that their animals are supposed to go with them as well. Are you comfortable? Again, we talk about asking the parents. They are the expert. Make sure you're speaking directly to the child. Help your child communicate. This is a communication board. A lot of these will basically, they push a button and then that will actually speak directly to you. Slow down, know if these kids and or yourself, you have some fear, you might be agitated, you might have a heightened or lessened sensory response, they do. And then we look at sound, again, sirens, folks, that'll put some folks over the edge. I look at a number of heart attacks that I have, MIs that I've transported from rural or out of county transports, and I'll shut the lights down and I'll leave the lights on and I'll shut the sirens off basically to keep that level of anxiety down. Be cautious about the touch. Use their, we talked about sensory kits, Michaela and I talked about sensory kits as well, and be prepared. That's one of our biggest things is making sure that we're prepared. Again, so now we get back to connecting with the families in your community. Connecting with the families in your community, that's where we open our doors. And yes, I realize that COVID is, the pandemic has definitely challenged us. We're getting back to somewhat of a semblance of normalcy, or as normal as we possibly can. And that's making an introduction and meet and greet so that it's a double win for everybody. So if you do a meet and greet and maybe perhaps you go to the family's house, you get to meet the child, maybe the child gets to come out to the truck and gets to see the truck, that takes their intimidation levels down to a more of a norm. And then as far as then you get to know one, you get to know the child, you get to know what's normal for them, you have an idea of what that diagnosis is, but you develop a relationship. And I think that's really key, is developing a relationship, not only with the child, but with the parents as well, and having an idea of what kind of equipment, and it's preparedness, all about preparedness again. So be proactive when we look at being proactive. So on the backside of what South Dakota EMS for Children is doing, we're working on a special healthcare needs group. And so I'll do some outreach to you right now. So I have a number of you folks are pediatric champion. Edna's one, Jackie's one. I'm trying to think of who else is. Let me look on here. Nancy, are you a pediatric champion? Renee is, Diana is. These folks are my pediatric emergency care champions, or our champions. And what we're going to do is we're going to build a program, but our whole goal is to build a program statewide. So my focus is going to be with that statewide focus is to identify. So you as a pediatric champion will identify a family member within your community that is passionate and wants to advocate for children with special health care needs. Then in turn, what we'll do is we'll bring a stakeholder group together, hopefully about 7, maybe 10 people at the most, bring those folks together. And then as we bring those folks together, then we can bring our issues, our fears, all of those things, and put them out on the table. And again, our focus is going to be those rural frontier agencies is what my focus is. And then we're going to put it all out on the table. We're going to start brainstorming. And then as we start brainstorming, then we're going to come up with a program that each, again, as a pediatric champion, that you as a pediatric champion can bring forward. And that would be training. So how do you train? What's the best? So let's say we have this little gal. Oh, you don't have it here. The child that you have on your screen right there. What's the best way to communicate with him? What is his diagnosis? What does he like? What does he not like? Those are all things that we would do as a pediatric champion to bring that forward. And then we'll go back and we'll do training, and it's specific training. And then what hospital is the best hospital to go to? So it's a all-encompassing program is basically what it is. So you need to be proactive within your communities. So if you folks who are pediatric champions already have someone in mind, please reach out to me and let me know who that person might be or who that family member might be. Ask the family member permission first, and then let's pull those folks together, and then let's start building this program. When we look at planning, we want to make sure that we're proactive, and that's super important. The kids basically have little fear. The family members, that's where we get nervous. But what we want to make sure we do is that you are trained up to take care of them. And then we want to take that training one step further. And that is for your local EDs, so those small town critical access hospitals, so that you have the training. And not only do you have the training, but then you know when to move these kids forward and move them to a larger hospital facility, being at the cities, being at maybe Sioux Falls, wherever they have to go. And then we need EMS representatives. That becomes about our 911, our EMS law enforcement. And then you have to have community buy-in with it as well. So lots of virtual training comes out there, a lot of CEUs and things as well. So believe it or not, guys, that's my mind map, if you will. And it looks like super, super chaotic. And it looks like I've been hoarding it. And I kind of have been. Dr. Reichman, who is our pediatric surgeon here at Sanford, he looks at this and he just shakes his head and he walks away. And he's like, oh my gosh. So that's a scary place to be, is inside my mind. But when you look at that mind map and you look closely at that mind map, it basically has everything laid out. So it starts out with the child with special health care needs. It goes from the parent, then it goes from 911 dispatch, and then it goes to EMS. And then how does EMS get that information? And how do you get the EMS folks trained? And it's just this all inclusive program. And hopefully that it will come to fruition. I'm hoping within the next year and a half that we really start making some big strides on it. So why do you need a coalition? We need those families, families or stakeholders to basically lift them up. So in your community, again, I invite you to have a conversation with one of those family members. If they are proactive and they want to advocate for their child or the children of their community, please send them our way. We'd love to have that conversation with them. We've got a couple of folks that are absolutely incredible that we're getting ready to work with, and we'd love to move that program forward. Developing a toolkit, we talked about that again. So pre-arrival information, we want to know what that is. It's really tough. You may recognize the address and know that you're going to a child with special health care needs, but wouldn't it be nice if you had the ability to take a look at what's normal, what's not normal? An interactive emergency information form or an emergency form would be nice. We have to keep that short and sweet for EMS providers, and keeping that short for EMS providers, we want the ABCs, A, B, C, and D. That's all we really honestly need. What's normal, what's not normal? How do we communicate with this kid? How do we take care of it? And then we move forward. One of my most difficult calls that I had a number of years ago was a family called 911. I was out in the county, and it was myself and actually it was one of the firefighters that was driving. And out walks a family member, and they have a baby in their hands, probably I would say 6 to maybe 8 months old. Hand me this limp gray mop, like the mops, the big mops that you have, that you're cleaning the floors with, the large mops. That's what the color this baby was. That's how limp this baby was. And then they hand me a piece of paper, and it's the directives and what I'm supposed to do and what I'm not supposed to do with this kid. Me, thank goodness we called for backup on that. It was me, an EMT in the back of the ambulance, and then we had one of the firefighters drive us in. So I had an EMT basically jump on board with me. I bagged the kid up. We bagged him. We took a blood sugar. Blood sugar was basically down into the low 30s. Started an IV, did an IV bolus, got my IV bolus on, put an AMP D50 in, and get them into the hospital. And again, it's a disease process that I am completely unaware of, or I have no education, did not even know that the child even lived in the vicinity where we were as far as rural as what we were. And go back and I read the paperwork. So basically it's a living will, and that living will was do not bag this child, which I threw that paper on the floor because I don't have time to read that. And I bagged him up, and the good part of that is that I didn't blow along, because I could have just as well blown along, but I was fortunate enough that we didn't. So those are things to kind of keep in mind. When we look at programs that are out there, there's Project Austin. Do you guys know where Project Austin came from? Taz, come over here. Do you know where Project Austin came from? Does anybody have a Project Austin kid in their community? There's 22 kids across the state of South Dakota. Fort Thompson, Pierre, Martin, T. I'm trying to think of other communities that off the top of my head. So I'll tell you a little bit about Project Austin. Project Austin kids go directly to Omaha Children's. So if you have a child who is a Project Austin child, that child basically has all of the information. They're doing training, they're doing a specialized training for that child in your community. And then that child goes into the ED, and then from the ED, they move them as quickly as they can, usually flight, and they get them down to Omaha to treat them is what how that program works. This program with Project Austin basically was started by Tiffany. Tiffany and her husband had a little guy, Austin, and Austin had a disease process, or a congenital disease process, and she needed assistance. So he had a trach, and with his trach that he had, i.e. stoma that he had, they suctioned and they needed help. So they needed help. EMS comes in. When EMS comes in to care for her child, they start bagging him, but they bag him over the nose. And her as a parent knows, because she's had enough experience with her little guy, knows that he needs to be bagged. He needs to be suctioned and he needs to be bagged. And they poo-pooed her. And consequently, they lost him. Then Tiffany goes to nursing school, and as she goes to nursing school, she spends some time in the ED, and then this is how Project Austin kind of came about. There are other programs that are out there as well. The STARS program, that's in St. Louis, Missouri, a phenomenal project. Again, that's EMS and fire are in with that as well. And I see absolutely no reason why the state of South Dakota can't pull something like this off. There are a number of us who, I have disability awareness training down there. There are a number of us in the state of South Dakota who are disability awareness trained. That's not just for pediatrics, it is for all walks of life and anyone who has a disability. And it teaches us how to communicate with those folks appropriately. And with the grant that came through South Dakota USD Center for Disabilities, of the number of folks that are out there, I think there might be 9 people trained. Most of them are the pediatric champions from South Dakota EMS for Children. So at some point in time, we'll get that up and going. And Edna, I know that was something that you were really interested in. We just couldn't get a train the trainer course. So we have trained the trainers with that, and we can do some smaller courses. So that might be a course that we could do for you folks as well later on. I think there's 5 or 6 of us within EMS for Children that are up and ready for that. A number of communities are doing some special healthcare need programs, and with those programs that they have, make sure you're taking a little bit of time and setting some time aside for those children with special health care needs that touch the truck. So it's a fun time where it is basically closed off to everyone else. You educate the staff, you include public safety, keep the crowd very small, no noise, no flashing lights, keep it quiet, let them touch the equipment, let them don and doff, and then figure out how you can help. Whoops, that was quick. How you can help. Putting those little guys in the driver's seat is a huge thing. If they want to push a button, make sure that, you know, if they're putting on a whaler or something, you make sure another child's not there, and we're going to scare the bejeebers out of them. Training, again, I really push on the training portion of it. Caring for children doesn't get better by chance, it gets better by choice. We've got a number of resources coming your way. We're working on a PECS perk, which if you're a pediatric champion, you're going to get first dibs on some of the equipment and some of the training that we're working at. When we have fewer patients, and those pediatric patients, you need to train more. Another adorable little one. Here's what we don't want to have, folks, happen to us. We don't want to be the headliners in the state of South Dakota and have that 13-year-old boy with autism shot and killed by a police officer. We don't want to have a deaf child who is inappropriately taken care of. We want to be able to handle these things before it becomes something that we can't take back, I guess is the best way to put it. So in conclusion of that, we're looking at their abilities, not their disabilities. How do we communicate with them? What's the best method, and how do we build a program? And I can't build a program, guys, without you. And you know the folks in your community, and how do we make the difference, and how do we make those changes, and getting folks involved in all of that. There was a survey, so we did our survey. Super proud of the state of South Dakota. 93 out of 126 services responded to the survey, which is phenomenal given the pandemic. Even though we've kind of absorbed it as kind of a norm, people are fatigued. Our EMS crews are fatigued, they're tired. And for me to ask for a survey was, it was hard for me to do that, to ask for you folks to participate. But when I'm asking you to participate, there's a reason that I ask you to participate. And that gives me an idea of what your needs are. And I think it's, you know, I'll be pretty blunt about it. The number of trainings and the equipment and the things that you've received from our office and asking for just a little bit of a survey, please provide me your time, and, you know, don't push it off. I had one service basically say, we didn't fill out the survey. We didn't want to fill out the survey. because you can get all your information from so-and-so, so-and-so from the Office of EMS. I can't get that information from them. And we haven't received equipment from you. That's somebody that's new that doesn't realize that the equipment that they've received has been from EMS for Children if it's pediatric or related. Again, if you folks have not, this survey can still be open. If you've not taken the time and filled out this survey, you can use that QR code right there, and using that QR code, you can tell me what some of your needs are as far as the non-transport agencies. We've actually, I just got notification this evening that some of the non-transport requests that I had for equipment and training have been approved by the Healthcare Coalition. So we'll see some things rolling out between I would say within the next month or two. So make sure you have pediatric champions on board. So even pediatric champions, if you're a non-transport service, sign up to be a pediatric champion as well. We definitely welcome you to the table. Talked about disability awareness training. There's a new PEP course out there. That PEP course is the 4th edition. We talked a little bit about PEC perks and then safety and injury prevention. So safety and injury prevention, we have a number of safety and injury prevention programs within our office. A lot of you folks who are up north know that Jamie Bartel joined our group here in November. And with that, our whole mission is, again, to make sure that every child receives the best care, but we also want to make sure that they're safe. So if we look at safety and injury prevention and what kind of programs that we can bring to your communities, or that we can do a train the trainer program in your community, and then you can use like-minded partners to lift those programs up, that's our whole intent. Don't thump your melon. It's not fine until they're 4'9". We have poison program. Diane just did a cute little book called Henry's Story that is a very tactile, true story, as a matter of fact. Jamie is lifting up the impaired driving. So she's really got to focus on teens and those at-risk youth. And then she's also lifting up pediatric safe transport. So that's for you folks who have ambulances and we're transporting kids. Yes, I realize that we don't transport many kids, but when we do need to transport them, we need to be transporting them appropriately. We do have funds for some safe transport devices, and they definitely will go to those ambulance services that have a pediatric champion. They'll go to those ambulance services that do not have a safe transport device. I actually had a small service call me the other day. I don't know if you guys still have them. It's the big yellow one that you blow up. So it's the big yellow, like the floaty tube. So it was a big yellow car seat, and it's been years and years ago. They blew it up and then it just split at the seams. So they'll be one of the first, and they have a pediatric champion. They'll be one of the first, and then they'll receive training on that as well. We've got the It's Not Fine Till They're 4'9". And then again, that seatbelt safety, pedestrian safety. Pedestrian safety is really important in our state of South Dakota. I think we've had 3 or 4 fatalities already in 2021. Because we're rural does not necessarily mean that we shouldn't be watching out for our kids or watching out for folks who are pedestrians. We need to be cautious. We tend to be a little aggressive in our state as well. Heartland EMS for Children, we put out a number of educational opportunities, and if you want to do a little more research and you want a little more education on children with special healthcare needs, go to our YouTube channel. And with our YouTube channel that's out there, we do have children with special healthcare needs. We have kids in crisis. That's a behavioral one as well. Unfortunately, if you did not attend those courses, you can watch them, you can learn from them, but we're not going to go back and do retrospective CEUs. And with that, I thank you for your time. Does anybody have any questions, suggestions, thoughts? How do we lift this program up? How do we get this thing jump started?
Anybody have any questions?
Table's all for you.
We got to have some out there, guys. I'm not going to give you hours. Not going to give you credit for your hours unless we get a couple questions.
I don't think he's quite that rough and tumble, but
Well,
those
maybe.
pediatric calls are scary,
When-
folks. Go ahead, Todd.
When's the next webinar? How's that for a question?
That's a good question.
It'll be in May, last Thursday of May.
May 27th.
So we actually, EMS for Children, or the HEC Coalition, is doing, and I'm not trying to tromp on your stuff, Michaela. We are actually, I'm sorry, I apologize. We're actually doing a training on EMSC Day. Oh, that's my daughter, for heaven's sakes. She's gonna have to wait. So we're doing a training on EMSC Day, which is on Wednesday, the 19th. It's over the noon hour. It's on stress and humor. So if you get a chance to tune into what we're doing, you can sign up on our Facebook page. And it's a gentleman who's going to basically, he calls it EMS capades is what he's calling it. And it's basically relating some of those pediatric calls that we have and putting a little bit of a twist of humor into it so that you guys can relax and get rid of some of those stressors. I know we're all super incredibly busy, but I hope you have the opportunity to actually attend, and it'll be a 1 hour of CEUs as well. So what I think is really amazing is I thank Northeast AHEC for basically reaching out, doing these pediatric courses, the HEC courses that are out there. We're really focusing a lot more on pediatrics and really lifting that up. And I think it makes it so much easier for you folks once you get out there and start treating these kids again. But I really appreciate it.
Do you take volunteers?
What kind of volunteer you want to be?
Oh, every once in a while, I guess.
What would you like to volunteer for?
What do you need?
Well, where are you located at, Todd?
Central South Dakota, about right in between Pierre and Huron.
Right in between Pierre and Huron. Are you a non-transport agency?
What's that?
Are you a non-transport agency, or do you have an ambulance?
What do you mean by that?
Are you fire rescue?
Do you have an ambulance?
Yes, on an ambulance service.
Oh, you do have an ambulance service? Okay.
Yep.
So our biggest goal right now is to jumpstart this children with special healthcare needs group. Is if you, within your community, if you sign up as a pediatric champion, you can do that on our website. And then once you do that, then our hope is to identify a family member who will advocate for their child with special health care needs. We'll get them on a stakeholders or on a focus group. And as we get them on a focus group, we'll start lifting those things up. And then how do we start pushing those programs out where we have basically where we can identify and we know ahead of time who those children are and what conditions they have and how we can best treat them. That's our whole focus, is what we're really wanting to do. But it all takes time to kind of pull all that together.
Okay. Do you have like do you have a list of the children that need special attention, or do we have to find them and bring them to you?
It would be the family member within your community. We do not. That's all. That would be all HIPAA, and the only place that you would find that is like when I showed you at the very beginning, the Department of Education basically is the only way that we're tracking that, and that would be within your school system. So, and I'm sure most folks, know within their community what family or families that we have out there, and it's just outreach, introducing yourself, letting them kind of know what you're wanting to do. I can give you a primary example. I crash into people. I don't do I don't do anything eloquently. I just, some call it the 6th degree of separation. That's not how I do it. I was in Costco. It's been probably about 6 months ago, and doing my shopping, kind of minding my own business. And there is this adorable little blonde, strawberry blonde haired kid, blue eyes, special healthcare needs. And I had an interaction with him, and oh my gosh, I was almost disruptive was our interaction. Cute, adorable. And I walked away. did my own thing, and then I stopped for just a short, brief period of time. And when I stopped, I turned back around, I looked to see if I had one of my cards, and then I went up to the parents and I said, hey, we're trying to get this group started. Didn't hear anything, didn't hear anything, didn't hear anything. All of a sudden I get an email just randomly, and she is the executive director for the American Academy of Pediatrics in the state of South Dakota. So we've been trying to work with them and to bring some things to light with them. Dr. Benson is very supportive of the group as well. It's just getting it jump started. So we need doers. So crash into some folks out there.
Cool. We got one that came in over the chat. It says, is there any written information that can be shared with a prospective family?
I think if we start anywhere, I would probably start with the, there's the AAP has the emergency information form, the EIF, and you can find that online. Our goal in the state of South Dakota, that form is, it includes everything but the kitchen sink, for lack of better terms. And as EMS responders, that's not the information that we need. We need the nuts and the bolts, how we fix this and what we're going to do in the process of that. So that's one of the things that we are getting ready to work on, but we need to work on that as a group. And what do the parents want? What do they want to see? And then bring EMS folks in, or our pediatric champions in, bring those folks in, and then really hone that down and then start getting that information out there. So my goal is to basically write a little manual so that you have a manual as a pediatric champion. And this is how we do a meet and greet. This is how we do a program to have families and make sure that they're prepared as well. So when we look at, we're coming up a tornado season, I guess. We're coming up with possible flooding season, you know, any of those things. But accountability and preparedness on their part is important as well. There is a good, I don't know if I can show you on my phone. There is a great app out there that I would encourage everybody to sign up for. Holy smokes, let me pull it up. Let me find it. Safety Central is what it's called. Can you see that? Can you see that, Safety Central? So even though that's for missing and exploited children, this is an awesome app, if you will. And with that app that we have, it takes you in and you put your child's name, their address, all of their information in it. Do they have birthmarks? Do they have, what color are their eyes? Do they have disabilities? Are they on medications? It does all of that. And then actually you can use your phone and actually fingerprint them as well. It's an amazing app, but even though it's for missing and exploited children, it's something that you can use at least to start and get your child registered somewhere. And the information is HIPAA compliant. So it's not something that's just out there.
Awesome. Thank you.
And our goal is to hopefully develop.
Anybody else? Okay, cool. Anybody else? Any questions? Carl, you got one? Go ahead.
It's more of a comment than a question, and that is, it's really nice to have someone share their evening with us like Corolla just did. And when Michaela puts these programs together with EMS and with AHEC, you know, it is very important to take advantage of these things because there's so many things we can learn. I am not in the healthcare business. However, I'm on the Health and Human Services Committee. So the more I learn about what you do, the better chance I can do a better job representing you in peer. Plus, it gives me the opportunity to meet more people. And, you know, there's things like Todd Warney. If I never, ever saw Todd or never, ever heard of him, then it would be really difficult if he called me one day. But because of these meetings, we have a chance to interact. And if you're in peer, you know who we are. So stop by, tell us what your needs are. I can promise you this, we'll at least look at them.
Thank you so much. We really appreciate it, Carl.
Yep, thank you. Michaela, you got anything?
Nope, I think we're good over on our side.
One quick thing that I wanted to bring up is obviously get this word out. We're trying email blasts. We're trying things like that. Follow Northeast South Dakota AHEC Facebook page. Put a favorites in your favorite bar for their website. There's a lot of really good information on there. And it also provides the link to maybe watching these webinars again or sharing them with other folks. And then also when we have these, the last Thursday of every month is the plan. And obviously we might run into something, holidays or whatever the case is, and then we would adjust from there. But the plan is the last Thursday of every month. We're very happy to have Corolla and her team talk to us a couple different times already. And it's been going really good, and we hope to see you again sometime. Also, when you are signing up, one issue that we ran into today, when you are signing up on the AHEC webpage, make sure that you look for that email that's going to come after you've registered for our classes. Sometimes it will show up in your junk mail. So if you haven't gotten that email within a couple of minutes, probably go look in your spam folder, your junk folder. We're always looking for topics. So if anybody's got anything that they really want to learn more about, let us know. Otherwise, we just kind of, I don't want to say we pick them out of the air, but we kind of just grab one and find an instructor to go through it. So if you have any needs, you have anything you really want, let us know, and we will be sure to get it for you. So with that, if nobody else has anything, that's all we've got for the evening. Appreciate everybody coming on, and be safe, and we'll see you next time.
Thanks, everybody. Hey, Kyle,
Thank
one of
you.
the things I might suggest
Yeah.
is some summer safety programs, especially when we look at drowning or near drowning.